adductors are there?
Longest, brevis, magnus.
Good, right? So longest goes from like pubic bone all the way down. Magnus is the large part of the muscle if we would grab the whole inside. Brevis is like that little short one, right? The other two muscles are the gracilis and the pectineus. The gracilis is that like guitar string one that's high up, again from the pubic bone down. What we're looking at for this test is normal abduction out to the side. So abduction, we're stretching those muscles, should be like 45 degrees. And if we're doing this, you're looking at the muscles on this side, so the adductors as well as the pectineus. If we bend the knee, because the gracilis is a two-joint muscle, then we should technically be able to go further if we bend the knee, because then that should be stretching just the gracilis, okay? Essentially what we're looking at is if they cannot passively get to a 45, they have a tight groin, okay? I guess as an athletic trainer, when I assess, as opposed to doing this, I usually do like a figure 4 and then have them relax down. Here you could be looking at multiple things. You could see if she has a tight iliopsoas and rectus, or if they have tight adductors, so your adductor group, right? All 5 of them. So adductor magnus, longus, and brevis is like this meaty portion here, but up high, this guitar string one that bounces back and forth, that's her gracilis, okay? So again, passively take them out to the side, assess if they can get to 45 degrees. Okay, great, you have good length of your 3 adductors and your pectineus. If I bend your knee and take you out to the side, now I also know you have adequate length of your gracilis. So if they can't get to 45 degrees, they have a tight groin, okay? This is a super fun stretch to do, so trying to find a better one for them, whether it's figure 4 or like almost like single leg Cossack squat, like out to the side, okay? To get gracilis, you'd have to bend your knee to do that.
When you're doing this one, make sure that their hips aren't coming with your leg too. Especially when you're on like a slippery table or have slippery clothes on, it's easy. If they're tight, they're gonna go with you.
Very good. And make sure that they stay in this flat plane of motion, because if she lifts up and does this, what muscle is contracting when she does a single leg lift like this? What hip flexor does this? Iliopsoas does this one. And if we would be looking at quad 2, it could also be rectus. If she's flat, then we're truly just looking at these muscles on the outside pulling her out, so glute med and TFL, but we're stretching the muscles on the inside, the 5 adductors, okay? Abductors, adductors, abductors, good. Okay, go ahead and try that one.